Hi everyone, my name is Melissa Wiedemann and I'm currently a third-year medical student, and I'm so excited to present to you today this case of an invasive pelvic angiomyxoma, its impact on our patient's quality of life, and the treatment we chose to use with a multidisciplinary approach. Let's go ahead and get started with the introduction. An aggressive angiomyxoma is a rare mesenchymal tumor. It's known for its aggressive invasion into any surrounding tissues. Diagnosis is often difficult as it has variable imaging and initial presentations. Misdiagnosis rate of this type of tumor is up to 70 to 100%. Now, diagnosis can be confirmed by MRI, which typically shows a laminating swirling pattern, and by biopsy, which often shows estrogen and progesterone receptor positivity. Now, there currently are no treatment guidelines due to the fact that these are so rare in clinical practice. I wanted to present to you our multidisciplinary treatment approach, which focused on our patient's quality of life and allowed for optimal results. Our case is that of a 37-year-old G2P2 female who was referred from her general OBGYN for a bulge in her pelvis. She also reported symptoms of polyuria, metorrhagia, constipation, and nocturia as well. Her past medical history was significant for hypothyroidism, and she reported a family history of a paternal aunt with breast cancer. Her review of symptoms revealed what we already discussed: the vaginal bleeding, increased frequency of urination, nocturia, and constipation. Her vital signs on physical exam were normal, but we were able to palpate a mass in the posterior vaginal canal, which led us to get some further imaging studies done. On CT, which you can see in the first two images on the poster presentation, a massive tumor was revealed. This tumor was measuring in at 26 by 15 by 8 centimeters, but it did not appear to communicate with any gynecologic structures. A biopsy then revealed a genital stromal tumor, which ended up initially being diagnosed as a leiomyosarcoma, but the final diagnosis was an aggressive angiomyxoma. Treatment, as earlier discussed, was kind of up in the air for us. We wanted to ensure that we took into consideration our patient's quality of life, so we started with a GnRH analog leuprolide. After several months, this treatment approach did not show any shrinkage of tumor, so we decided to think a little bit out of the box and proceed with cryotherapy. And we were able to deem this a success as we created a large zone of central liquefactive necrosis in the tumor. This allowed us to proceed with the surgical resection. The surgical resection was also a success. You can see in the third and fourth images on the picture, we were able to remove an estimated 2/3 of the tumor. The other 1/3 had deeply invaded the pelvic musculature and had to be left behind. However, after the surgical resection, our patient reported a huge improvement in symptoms and an improvement in quality of life. There's a few things I wanted to discuss about this case that I feel are important. So far, only 8 cases of ischioanal fossa angiomyxomas have been reported, and their treatments have been limited to just excision. We were able to utilize cryotherapy, which has been used before in prostate and other types of cancers, and we were able to provide liquefactive necrosis and shrinkage of the tumor. Now, cryotherapy is utilized by inducing vascular stasis and apoptosis, which is what creates that liquefactive necrosis. And in the end, we really wanted to focus on the emotional aspect of this tumor. On initial diagnosis, treatment possibility included bowel resection, colostomy, and even fecal and urinary incontinence, which was naturally extremely distressing to our patient. We came up with this treatment approach because we wanted to focus on our patient's outcome. We hope that in conclusion, you have been able to realize the extent of this diagnosis, and we hope that this treatment approach can be used in future patients as well. Thank you so much. Have a great rest of your day.